going to continue now and cover the critical control points and quality control points for the cattle section of the Texas Cattle Feeders Association Beef Safety and Quality Assurance Program. If you remember a schematic that we had on feed sources used in the feed yard, which basically went from receiving that feed until the feed was delivered to the cattle, you can see on this schematic for the cattle we have the same approach, beginning with cattle coming into the feed yard and continuing over until cattle are shipped from the feed yard. As we had with the feed sources, we have a number of critical control points as well as quality control points dealing with cattle. Notice as we begin with incoming cattle, we have a quality control point on incoming cattle, quality control point dealing with animal identification, quality control points dealing with the use of growth implants. Then when we move to injections, which would deal with our animal health products, we have a critical control point as well as quality control. A number of other quality control points as we move through the schematic. Then another critical control point dealing with processing and treatment of animals. Once again, this will deal with the proper use of animal health products. And then finally, shipping of those cattle. Let's look at these individually. Begin with the critical control points for the cattle. We have one dealing with injections, one dealing with processing and treatment. When we move to injections, our hazard that we're concerned with here would be broken needles. And these would be broken needles that remain embedded in the animal after they break off. This is a critical issue because broken needles in beef, although they're a rare problem, they are an important hazard. And we do have reports about once a year. I'll hear a report of where some animal or some food product that had a broken needle in it. We need to protect against that in our cattle operations. Criteria and critical limits. As you can imagine, zero tolerance. We do not tolerate broken needles that remain in animals. Our monitoring procedure, we have procedures both at the chute and then also documentation procedures. Our procedures at the chute or in our processing facilities is that the processors that are using the syringes, using the needles to inject animal health products, visually check the needles after each injection to ensure that the needle is not bent and also to ensure that the needle is still present on the end of the syringe. Corrective and preventative actions. What if a needle breaks off and remains in an animal? Well, a preventative action to prevent this from occurring, once again, is to change needles frequently and when that needle is damaged or bent. A common recommendation would be every 10 to 25 head of animals, change the needle. This, again, puts a fresh needle on onto the syringe. It reduces, or it maintains a sharp needle that goes in the animal more easily and also prevents any damage or trauma to the tissue around where the injection was administered, but also then ensures that we have a needle that has integrity and will not break off. A second part of the preventative action is proper restraint of the animal. Many times when a needle may break off is because the animal is not properly restrained, they're moving around, and therefore the needle breaks off. So proper restraint, proper operation of the chute, and changing the needles are two primary preventative actions for broken needles. Corrective action would be what if that needle does break off. First would be the crew would try to remove that needle from the animal. This may be as simple as locating where the injection was administered and using a surgical scalpel or an extremely sharp knife to make a small incision in the skin, then reach in with a pair of forceps and pull that needle from the animal. If that's not possible, notify the veterinarian and see if they can surgically remove the needle from the animal. Whatever the occurrence, that animal needs to be identified. The individual ear tag or some individual unique identification for that animal, that this animal has a broken needle in the animal. That incident needs to be recorded, and the management must be notified that that needle broke off in the animal, and then what was the status? Was the needle successfully removed, or was the crew unable to remove the needle? Suggested records would be the processing orders that are signed by the crew, and also the daily hospital report signed by the crew. These are two records that when an audit is conducted on the feed yard, the auditors will look for these records. They will look at the processing cards or the processing orders for a group of cattle, and check to see that the processing card indicates that there were no broken needles, and that is signed by the leader of the processing crew. They will also check the daily hospital reports to see that there were no needles reported, and also that that is signed by the head of the hospital crew. Verification procedures then once again would be managerial review of those processing cards and the daily hospital reports to ensure that there were no broken needles, and also that those reports are being signed for documentation purposes. Our second critical control point on cattle would be processing and treatment of the animal. And once again, as we talked about with feed medications, we are now talking about residues that might occur from the use of pharmaceutical products to either prevent health disorders or help treat animals that are suffering from a health disorder. The issues here would be chemical residues that might occur from vaccines, antibiotics, parasiticides, and these residues might occur as a result of improper dosing or insufficient withdrawal time before those animals move to slaughter. Our criteria and critical limits: zero tolerance. Once again, we have zero tolerance for animals leaving the feed yard that may potentially be carrying a residue in their tissues that could be introduced into the food chain. We need to follow label or veterinary recommendations for dosage or withdrawal times. The veterinarian is the professional animal health consultant for the operation. They develop the protocols, they develop the recommendations for the products being used, and assign the proper dosages and withdrawal times for those protocols, and we need to follow those. Extra label drug use can only occur on the direction of the consulting veterinarian. Let's briefly review what extra label drug use is. Extra label drug use is the administration of the drug in a manner that is not stated on the drug's labeling. Each animal health product has a label that has been approved by the Food and Drug Administration that specifies the routes of administration, the dosages, and the withdrawal times in animals that have been had those drugs administered to them for health purposes. So anything that we do that is not listed on that label is considered extra label use. So once again, this would include the use in a species not listed on the label. For instance, using a swine medicine to medicate cattle, that would be extra label use. Use for diseases or symptoms not listed on the label. So we have an animal that's suffering from a health problem, we use a certain antibiotic, but it's not, the indications do not indicate on the label that that would be proper use of that antibiotic. That would be extra label use. Use at a dosage level higher than stated on the label would be also extra label use, or using in a route of administration not listed on the label. So for instance, an animal health product that may be labeled for intravenous or IV use only, if we apply that subcutaneously or intramuscularly, that is extra label drug use. Extra label drug use can only occur under a veterinarian's direction and supervision. So it may be possible to use these extra label applications of animal health products, but this must occur under the direction and supervision of the consulting veterinarian for the feed yard. Also, any extra label drug use requires an extended withdrawal period, and that must be designated by the consulting veterinarian. So once again, under our criteria and critical limits, if we're going to use drugs or animal health products that are not labeled for beef cattle, that must be under the direction of the veterinarian. If we're going to use those at a dosage rate above that on the label, it must be under the direction of our consulting veterinarian. Or if we're going to use a different label, or different route of administration for that animal health product, it must be under the direction of the consulting veterinarian. Monitoring procedures for the processing and treatment to avoid residues of products in animals would be managerial observation of the use of these products. The cattle manager, the crew leader, whatever member of the feed yard personnel staff that is responsible for supervising the use of those products makes certain that the protocols are being followed properly. Maintain records of treatment dates and withdrawal times for animals. Potentially a test such as what's called the last test, which is a test that can be used to test the urine for any residues that might still be in the animal. Might be something to be used especially in a situation where you've had animals that have been ill or had extra label drug use. Some spot tests such as the last test might be useful. A critical point, though, once again, one of the things that the auditors will check each time they are conducting an audit at the feed yard is they will check the, quote, safe to ship reports on lots of cattle. That's a report that's run before the cattle are shipped to show any animals that may not have cleared withdrawal times for animal health products. That report is checked, and we check to ensure that the cattle manager, the assistant manager, or whatever staff member is responsible for checking that has signed off on the report to indicate they've checked all those animals and removed any animals from the lot that have not cleared withdrawal times. Corrective or preventative actions for residues of pharmaceutical products. Again, our preventative actions. How do we prevent this from occurring? Good employee training. What's the proper use of the animal health products? How do we check our withdrawal reports? How do we test animals in case we need to make sure they're not carrying residues? Good employee training. Written directions on the use of products. Have our consulting veterinarian provide written protocols on how to treat animals, what antibiotics or animal health products to utilize, and how to use those. Using the proper dosage. Most of our feed yards today have scales underneath the chute, so we know what individual animals weigh, and we can adjust the dosage based on their weights. Establish withdrawal times and dates. Once again, record the date that that animal was treated so that a withdrawal time can be established and checked before that animal leaves the feedlot. And then, as we talked about on the safe to ship report, clear each animal before they ship to ensure that they're clear of any potential residues. Corrective action, what occurs if an animal leaves the feed yard and we find out that they had potentially were carrying a residue or had not cleared withdrawals. We need to identify who that animal is and immediately notify the purchaser that an animal that left the feed yard may not have cleared withdrawals. Suggested records. Again, our processing orders. Who, what, when, and where occurred during processing of those cattle. Treatment records. Once again, who, what, when, and where was treated for a health disorder, what was utilized, what was the dosage rate, what's the withdrawal time associated with that animal health product for records. And then those shipment records, the safe to ship reports that have been checked and signed by the appropriate feed yard management personnel. Then finally, verification is again managerial review of the records, approval of the withdrawals and shipments, making sure all those documents are checked and signed. So those are the two critical control points within cattle, the cattle segment of the Texas Beef Safety and Quality Assurance Program. Now let's quickly go through the quality control points for the cattle segment. Once again, we have 7 quality control points dealing with quality issues in the cattle. And remember, quality control points deal with efficient, effective management and production of cattle in our feed yards. First would be incoming cattle. Visual assessment once the cattle arrive. Are they high risk, low risk, shrink, issues such as this that may indicate potential problems with the cattle. And arrival time and transit time. When did they arrive? How long were they in transit? All may be issues we want to monitor to get a better idea of how we may need to manage those cattle once they arrive. Corrective preventative actions may include accepting the load of cattle, rejecting a portion or all of the cattle on a load, or applying a discount because of quality issues. And then informing your supplier and or your customer of potential problems that might occur with a load of cattle. Suggested records, pre-arrival expectations. This may be what kind of cattle did we order, what weight, what condition, and did they meet those specifications once they arrived. And then also keeping a receiving report on the cattle. And then finally, verification would be review by the management to make certain that the cattle are meeting those quality aspects. Second two more quality control points for cattle quality would be dealing with identification of the cattle, both tagging or branding of the cattle. Things we might be concerned with would be infections that might occur because of tagging or branding procedures, interference with or destruction of implants. The ears of the cattle are used for both identification with ear tags, but that's also where we place our growth implants for the animals, so there may be some interference with those. And then issues from a quality standpoint would be location and size of brands that have been applied to the cattle or that the feed yard may apply to the cattle. And these issues all deal with potential health problems to the animals, potential performance loss, or hide devaluation because of the branding procedures. Criteria critical limits. What are the processing standards established by the feed yard? That would be our criteria that we would deal with. Monitoring procedures would be managerial observation of the processing crew to make sure that things are being applied correctly. Corrective or preventative actions. How do we prevent a problem from occurring? Things such as, once again, employee training. What are the proper procedures? Disinfecting tag applicators to reduce the chance of infections in the ear from the application of the ear tags. Proper placement of the tags or brands on the cattle. Corrective actions, if we have problems occurring, is simply to modify procedures and possibly go through employee training one more time. Suggested records, we don't have any of those recommended necessarily. That would be up to the management of the feed yard. Also, verification procedures would be up to the management of the feed yard. Implants and reimplants. Again, we use implants, growth implants in cattle to improve efficiency of production from those animals. Again, these are safe. We're not creating tissue residue problems. We use these to enhance growth and performance of those animals with the feed sources that we have. Issues that we would be concerned about would be potential performance loss, possibly the increased incidence of buller type cattle from the use of implants, or devaluation of carcasses that might result from implants that were abscessed, implants that were crushed during the administration procedure, improper placement of that implant, or the wrong interval of use of implants in the cattle. Criteria critical limits that might be considered would be whatever the standards that are developed by the feed yard or the supplier of those implants. Also, the implanting and reimplanting schedules that may be established by the consulting nutritionist. Proper disinfection of applicators to avoid abscesses in the ears around the implants, and then also proper placement procedures for those implants. Monitoring procedures, once again, simply managerial observation of the cattle processing crew to make sure things are being conducted correctly. This might also include observation by the consultant or a company representative that's supplying the implants to the feed yard, and also training and certification programs that might be available for the processing crews. Corrective or preventative action. In the case that we have problems with our implants, preventative, once again, to prevent problems would be proper employee training and proper administration procedures, developing appropriate implant and reimplant schedules to be used with different groups of cattle, proper placement of the implant in the ear, and then disinfection procedures for the applicators. Corrective actions in the case that we are, or that an unusual incidents of abscesses or other problems of occurring, corrective actions would be, again, to modify the procedures being used by the crew or possibly change processors if the modification of procedures doesn't correct the problem. Suggested records may be ear palpation, where someone goes in and checks the ears on the cattle to make sure the implants are being retained and that there's no implants and other issues with the implants. Processing records, and then again established implant and reimplant schedules and protocols for the cattle. And then finally, verification, once again, is managerial review of records and other procedures to ensure that the implants are being placed properly and are having the opportunity to work properly. Injections is another quality control point. We talked about potential tissue residues that would occur from the use of animal health products. We have another issue from a quality side which deals with injection sites. These would be injection site lesions and also product efficacy. Does the product work well? Our issues here would be animal health, potential carcass value problems, and then performance of the animals because of the product efficacy issues. Criteria critical limits would be that we use the proper injection site locations in the animal. As a rule of thumb, all injections in animals are recommended to be placed in front of the shoulder. As we can see on the small diagram in the top right-hand portion of this, the green trapezoidal area up on the neck of the animal, which occurs on both sides of the neck, so you have two sides, would be the proper location for all injections to occur. Not in the shoulder, not in the rump, or in those portions of the animal. Those are where the high-value cuts come from the animal. Up in the neck, that is typically used for ground beef products or some other product, and so the lesions, which the lesions do not create a potential health issue for the consumer, They're just an unsightly blemish that occurs in the meat, and so since those products up in the neck are typically used for ground beef products, those unsightly blemishes are not apparent. Monitoring procedures, criteria and critical limits, again, injection site location, proper handling and mixing of animal health products to ensure that the injection of that animal health product does not create a blemish, using the proper dosage and following the labeling requirements for route of administration and dosage requirements for those animal health products. Monitoring procedures, once again, managerial observation of the processing crew, the hospital crew, treatment of the animals to ensure that the injections being placed properly and protocols are being followed. Also checking expiration date on products to make sure all products have not expired. That deals more with product efficacy and will the products work properly. Corrective preventative actions, once again, good employee training. How do we do it? When do we do it? Why do we do it? To ensure that we don't create blemishes and that our products work properly. Proper injection placement, following the dosage guidelines, changing needles. We talked about changing needles earlier to avoid broken needles. Changing needles can also reduce the incidence of injection site blemishes because we keep a sharp needle that has less tissue damage or less trauma to the tissue when that injection is placed in the animal. Using sanitary techniques as best we can to avoid infecting that injection site. And then finally, modifying procedures. If we have a problem, let's go back and modify our procedures so that we may be able to correct that problem. Suggested records would keep the processing records and maps for the groups of cattle. These are basically directions on how to apply the products and also a record of what products were applied and how they were applied. And then finally, verification would be up to the feed yard, whether that's reviewed by the cattle manager or some member of the management team to ensure the protocols are being followed properly. Let's talk just a bit more about injection site lesions, why they're important. Again, injection site lesions, which you can see from the picture in the upper right-hand corner, would be an example of injection site lesions. These result in product loss for the retailer and the consumer. Because as you can imagine, if a consumer walked into a store and saw a blemish such as that in that round steak in the upper right-hand corner, they're not going to necessarily want to buy that product. As I said earlier, these injection site blemishes do not represent a food safety problem. These are safe products, but you can see that if a consumer saw that in the store, they would think there's something wrong with that piece of meat. So in order to sell that product, the retailer or someone prior to the retailer has to trim that injection site lesion out, or that round steak that you see in the upper right-hand corner may have to end up in a ground beef product, which has a lower value than a round steak would. So these injection site lesions represent a product loss as well as an economic loss for the industry when they occur. Also, injection site lesions, even if we could go in and trim that injection site lesion out of that piece of round steak, that injection site lesion creates tougher beef tissue around that injection site lesion as much as 3 inches away. So if you think about something about the size of a grapefruit, 3 inches in diameter around that scar, that meat has become tougher because that scar was present. So we create a beef product that is less acceptable from an eating quality standpoint. And then finally, ultimately, is consumer dissatisfaction. They don't want the tougher beef. They do not want that unsightly blemish in the beef products that they're buying. What causes the injection site lesions or blemishes? Irritation from the chemicals in pharmaceuticals. Many of the injection site lesions are the result of some of the vaccines that we use, and the way vaccines work is they must create irritation inside the tissue of the animal to attract the immune system to that location, so the immune system can then develop antibodies that protect the animal from any future exposure to that disease. Well, those chemicals that are necessary to create that immune response also irritate the tissue and can create that injection site blemish. So once again, we do not want to put those into the high quality or high value cuts of meat on the animal. We put those in the location on the animal where the vaccine will work, but it will also be in an area where the value of that meat cut is not going to be discounted greatly. We can also create an injection site blemish by the amount of product that we inject into one site. If you look at many of our animal health products, they have on the label, they will have dosage guidelines, do not exceed X milliliters or cc's injected at any given site. That's not only affects the efficacy of that animal health product, but it also increases the chances of an injection site blemish because we injected more of that product into one site than should have been injected at that site. Damaged or dull needles can create more trauma and create an injection site blemish. And then contamination of the injection site with mud, dust, manure, things we all deal with in the feed yards can create that. We can't get away from it, but we need to do the best we can to avoid that kind of contamination. Again, prevent and minimize injection site blemishes by number one, administering all injections in front of the shoulder, in the green trapezoid on the diagram. Use label routes of administration. If possible, use the subcutaneous route of administration for products because that injection site then is between the muscle and the skin and does not create a blemish that remains in the muscle. Follow the label guidelines for the amount injected in each injection site. Use as sanitary technique as possible when we're processing or treating animals, and then change damaged or dull needles to reduce the amount of tissue trauma that occurs with that injection. Another area of quality control point would be banding and tipping of animals. This would deal with intact males that arrive at the feed yard or animals that have horns when they arrive. Again, issues here would be potential animal health problems. In the case of intact males, ultimate effects on carcass value from those animals, and then finally performance issues that might have occurred because of animal health issues. We're concerned about infections that might occur, partial castration of the animal from banding. In other words, the testicles are not completely removed and we end up with an animal that's staggy, which can affect carcass value, heavy bleeding that might occur, or excessive swelling that might occur from these procedures. Again, our criteria critical limit is work with the consulting veterinarian for the feed yard to develop the protocols and the proper procedures when banding and tipping animals. Monitoring procedures, once again, employees observing the animals that were either banded or had their horns tipped, and also managerial observation of the procedures that are used as these animals are processed. Corrective and preventative actions, good employee training, disinfection of instruments that are used in these procedures, and if we still have problems, modify our procedures that are used in the handling of those animals to reduce the probability that we have an issue that results from banding of intact males or tipping horns on other animals. Suggested records, simply keep our treatment records to see if we have a higher incidence of problems with these animals. And then finally, verification would be managerial review of the records. Another quality control point in the cattle section is cattle handling. Texas Cattle Feeders Association has updated the Texas Cattle Feeders Beef Safety and Quality Assurance Program to include an entire section on proper cattle handling and management techniques. We will address that in another section of these presentations, but we'll review some of the issues today that were initially cited in the Beef Safety and Quality Assurance Program. One of the major issues cited in this quality part would be carcass value. Specifically, bruising that may occur because of handling issues with the cattle, or another would be dark cutting cattle that occur because of potential handling problems at the feed yard. Bruising, when a carcass at a processing plant has bruises, those bruises are trimmed out of the carcass. So that represents a product loss. If you're selling cattle on a grid, on a carcass base, then that's a weight loss for the cattle feeder that sold the cattle. If the cattle have been sold on a live basis and those bruises are trimmed out, that's a weight and product loss for the processor. Bruising is something we want to avoid. This can deal with cattle handling. Dark cutters are animals that have been stressed in some fashion prior to, within 24 to 48 hours of shipment to the processing plant. Essentially, the sugar in their muscle called glycogen has been depleted. In their muscle, there's nothing wrong with the eating quality of the muscle necessarily or the beef quality. It's just that it's a dark maroon color rather than a bright cherry red, as you would expect that lean tissue to be. So it can also represent loss in carcass value because those carcasses are discounted because they are dart cutters. We need to manage cattle so we avoid bruising and the potential for dart cutters. Then our criteria and critical limits are that we have proper handling of those animals when we move them, when we're handling those animals, in good facility design for low stress handling of the cattle, low stress movement of the cattle, and fewer opportunities for the animals to have a bruise from hanging on a corner or running into a gate or some other issue that might create a bruise in those animals. Monitoring procedures, managerial observation of the employees and how they handle cattle. And then also packing plant reports. What's the incidence of bruising or carcass trim? What's the incidence of dart cutters as cattle have moved into the processing plants? Corrective and preventative actions, once again, good employee training on proper handling procedures, notifications of truckers and shippers that may also be responsible for some of these issues, and then modifying our handling procedures and our facilities at the feed yard to reduce the incidence of these problems. There are no suggested records, no suggested verification procedures. Leave that up to the feed yard for their own discretion. As I mentioned, there's another section of this program that deals completely with the cattle handling side of it. We call that the animal or cattle handling and care audit. We'll discuss that in a separate section of the program. In that, we look at the condition of the feeding pens, the condition of the hospital and processing facilities, the condition of the shipping and receiving facilities, and then we also observe cattle handling and cattle behavior through the processing facilities. And we'll talk about that in more detail in a later section. So to wrap up on the cattle segment of the Beef Safety and Quality Assurance program, we had two critical control points. One of those dealt with injections, the other dealt with processing and treatment of the animals. Once again, these deal with broken needles and residues that would occur in the animals that would create a food safety problem. So these both address food safety issues. Then we had 7 quality control points focusing on cattle that would address health, performance, and effective management issues of those cattle while they're in the feed yard. The final section that we'll discuss will deal with pharmaceuticals and biologicals that we use in the feed yard. In this, there are no critical control points. These are all quality control points that deal with these pharmaceutical and biological products. If we look under pharmaceuticals and biologicals on the schematic, once again, you can see we have a quality control point under purchasing, a quality control point under receiving and storage of those pharmaceutical and biological products, and finally a quality control point under handling of those products. Each one of these deals with the efficacy of those products, how well they will use, how successful we will be using those products in the animals to promote better animal health. Under purchasing, the things we need to be concerned about would be adulterated products and product efficacy. Once again, we want those products to be efficacious so that we promote better animal health and we promote better efficient performance of the animals. Criteria and critical limits here. Again, we want to use reputable suppliers of our animal health products, and we want product specifications for each one of the products that we purchase and utilize so we can have those specs outlined and know what we're purchasing. Monitoring procedures. The feed yard should have a list of reputable pharmaceutical suppliers. Corrective or preventative action is order pharmaceuticals and biologicals only from those approved suppliers for the feed yard. Suggested records would be to keep our invoices of what we purchase, keep good track of inventory, and have a good vet-client-patient relationship, which most feed yards do, and that involves having that veterinarian that knows the feed yard, knows the type of cattle that are being managed at the feed yard, and therefore can develop the protocols for animal health procedures and help develop that list of products to be used on the feed yard. Under receiving and storage, once again, we're dealing with product efficacy and how that affects animal health and performance. Our criteria and critical limits: follow the label requirements for temperature for storage of those products, and also monitor product expiration dates so that we make sure those products are not expired that we're using, and that can affect efficacy. Monitoring procedures, again, proper storage. Our storage rooms, do they have proper temperature? Are the bottles the inventory being rotated appropriately so that expiration dates, so the products are used prior to expiration dates? Rotation of open containers. Some of our products, we may partially use those. We need to make sure we go ahead and use those open containers up, or possibly dispose of those open containers even though they're partially utilized. And again, inspection of the storage room and inventory control would be monitoring procedures. Corrective preventative actions. Discard damaged or expired products. Suggested records that may be useful would be inventory records to make sure the inventory is being turned appropriately, and then a temperature log for the storage areas to ensure that the storage areas maintain at proper temperature to maintain product efficacy. Then under handling, under quality control, would be deal with damaged containers, contamination of containers, exposure of our pharmaceuticals and biologicals to heat or light, impartial containers that are not immediately used after they're opened. All of these can affect product efficacy and then affect our animal health responses. Criteria and critical limits to be considered here: limit the times products are handled. How many times can we use an open container before we dispose of it? How many times do those products change hands between the storage room and the processing barn, and factors that may affect their exposure to temperature and ultraviolet light? And then establish guidelines for chute-side storage and handling of these products while they're being used out in the processing barns or in the hospitals. Monitoring procedures. Observe chute-side handling of these products and their administration. Corrective and preventative actions. Again, discard damaged products and good employee training on proper handling, storage, management, and use of these products to ensure efficacy. Suggested records might be inventory records, once again, to turn that inventory, make sure products are not expiring, and disposal records to know what has been disposed of and when. And then again, verification would be managerial oversight and review of records. One thing to remember on vaccine, which is our first line defense against health problems and hopefully will help us avoid performance declines and the use of other biologicals or pharmaceuticals, is that for a vaccine to be most effective, it must be kept out of direct sunlight and ultraviolet light. It needs to be kept cool at all times, and it needs to be administered in as clean an injection site as possible. So those are three things to keep in mind as we handle these products. So that's the brief overview of quality control points dealing with pharmaceuticals and biologicals. Again, these affect health, performance, and effective management of cattle that we have in our feed yards. And that wraps up our section on food safety and the critical control points and quality control points for feed resources, cattle, and our pharmaceuticals and biologicals that we use in our feed yards.